A boy from White Plains lived for 13 years after being injured at birth. His mother fought for every one of those years while also battling the state's medical indemnity fund. Tonight, investigative reporter Mahsa Saeidi explains why this fight continues and what her son's life and death reveals about a state program on edge.
As a parent, there's a sense of calmness that comes to you knowing where your kids are at all times. And my son is dead. I'll post videos of him because I don't want to ever forget him. And I know I won't. I don't want the world to forget him.
Denise Olivo has been fighting for her son, Gian Raul, known as Gimo, since the moment he was born. Gimo suffered a neurological injury at birth due to medical malpractice. In New York, families like his don't collect full damages from hospitals. Instead, the state promises to cover their health care for life through a program called the Medical Indemnity Fund.
I'm tired of fighting.
2 years ago, Olivo told me she had to fight the fund when it delayed or denied claims, including for a wheelchair van lift. In January, at just 13 years old, Gimo died from pneumonia. Months later, Olivo is still wearing the wristband from his last hospital stay.
It's like the last thing that I had to show people that I'm his mom.
Gimo, my boss, he full of a lot of life. He lived through his eyes, as you know.
For 8 years, the person who showed up 6 days a week, 12 hours a day, was Kevin Emmanuel, Gimo's nurse, his companion, in many ways, a second dad.
The crazy thing about it is, while Gimo was going through that process, it brought back so much memory because it's the same hospital, same unit that my son past Gimo was.
In 2018, Emmanuel's son, Kevin Jr., a child with special needs, died in that same hospital.
He passed at 3, but he lived a lot of life because me and my wife, we never restrict him.
Soon after, Emmanuel started working with Gimo.
He allowed me to care for him the way that I would care for my son.
Other families in the fund tell me nurses like Emmanuel are the reason their children have a life worth living. We've been investigating the fund since 2024. Last year, after our reporting, funding quadrupled to $211 million, projected to last only until this July. Now Governor Hochul is proposing $75 million to keep the fund open. But to help make it sustainable, the budget would cut reimbursement rates for private duty nursing and other non-physician services. Right now, nurses earn competitive market rates. Under the proposal, they would drop to New York State's lower Medicaid rate, saving the state a projected $50 million.
What would happen if they cut rates to nurses?
It'll be much harder for families to get nurses to actually want to stay.
The governor's office says Governor Hochul, quote, remains committed to keeping the fund open. Budget negotiations are still underway. For this family and nearly 1,000 others, the fight is not over.
Kevin and Gimo, I'm glad that I was in your life, even though there's special limitation to treat them as a regular kid. Only us see them as special, but they see themselves as regular kids.
He made an impact, a substantial impact.
Nurses are currently reimbursed based on private market data. A lawmaker tells me the state sets the rate and it's not public. Under the governor's proposal, they would get the Medicaid rate, which again is less. In KJ, we have asked the Department of Health for the exact dollar figures.
Mahsa, I remember when you first introduced us to Gimo, I remember that scene vividly of him getting into that swing apparatus to get treatment. It was one of your first stories on this issue. Thinking about his family here tonight, please give us an update, though, on these budget negotiations and where they stand.
So the Assembly has rejected the governor's $75 million proposal. They've countered with $207 million. No decision has been made, and we'll keep you up to date.
All right, Mahsa Saeidi, an important update here tonight and a story that we'll continue to follow. Thank you. If you have any story ideas for Mahsa, scan the QR code there on your screen. You may see the story on air.